All right. Well, as you can see, if you're new to Zoom, I assume a lot of people are no longer new to Zoom. Maybe a few months ago you were, and I'm sure there's still maybe some people, but with everyone or a lot of people working from home. But for those who aren't expecting their name to show up on the screen,
Well, as you can see, if you're new to Zoom, I assume a lot of people
hold
are
on a
no
sec. Let
longer new
me.
to Zoom. Maybe a few months ago you were, and I'm sure there's still maybe some.
All right, sorry, that didn't happen last time, so I could hear myself on YouTube Live, so I had to mute myself there. All right, let me get back to Zoom here. Huh. Sorry, having some technical difficulties here. All right, I guess this will work here. Just all right, so all right, let's get rolling here. Sorry about oh, actually, one other thing. It is recording automatically on YouTube, but not on Zoom. So let me just do that. And all right, why don't we briefly just feel free to type in where you are Zooming from or YouTubing from. Just in the chat. I'm in Matthews, North Carolina, which is just outside of Charlotte, North Carolina. And we have Estella from California and Bowling Green, Kentucky. Kylie from Western Australia. All right. And then another Denise from Sunshine Coast, Australia. We got Gail from Freeport, Maine. Chanel from Philadelphia. And then Rick, not too far away from me at Wilmington, North Carolina. Shante at Great Falls, Montana. And then Galaxy at UK. Well, probably not. Anyway, so for someone else from UK, London. And then Annette, Boston, Massachusetts. Faith from Vancouver, Canada. And I'm not sure if I'm going to pronounce your name right, but Amishi from Huntersville. All right. Yeah, Huntersville, North Carolina. Riri from Los Angeles, California. All right, good deal. So, all right, so we'll get into questions shortly. If just briefly, let me see if there we go. All right, so again, as I mentioned, everyone on Zoom can see each other. So if you want to rename yourself, just click on the buttons on the upper right-hand side, the little three dots. And I'm gonna mute everybody. Everybody's muted now, just to keep the background noise down. And we'll be using the chat feature, just because when I've done these, it's even with the chat feature, I usually don't get to all questions. And if I start unmuting people just to answer questions, it'll no doubt take longer than that. And I want to try to get through as many questions as I can. And again, try to make questions short and to the point whenever possible. And just keep in mind, I can only give specific recommendations to my patients. So as far as like, if you have questions about stopping antithyroid medication or other types of medication, or I mean, just yeah. So I'll try my best if you to answer questions, but there are some limitations. And then this last bullet point, as far as trying my best to diversify, what I mean by that is just if someone asks a lot of questions, I might skip around just to make sure I get to everybody. My goal is to try to not only answer as many questions, but try to get to at least everyone at least one time if I can. But I'm sure I'll answer multiple questions from people as well. Just yeah. So So I had a day chat about, I guess about a month, well, a few day chats, but some of you might have attended. And the next few slides will be a little bit repetitive. So I'm going to go through these quickly, but there's a few different causes of hyperthyroidism. There's Graves' disease, which of course is autoimmune, toxic multinodular goiter. And I do have an article or blog post that I released on toxic multinodular goiter a couple of weeks ago. Subacute thyroiditis. It's been a few years, but I also have articles, blog posts on subacute thyroiditis, as well as one on Hashimotoxicosis. And then, so achieving your health goals. So, you want to ask yourself, what do you want to achieve with regards to hyperthyroidism? Most people are looking, at least most people attending this chat here, looking for remission, to get into remission from their hyperthyroid condition. So of course, with any health condition, hyperthyroidism included, you need to find triggers and underlying causes of your condition. And as far as what do you want to avoid, I think it's also safe to say that most people want to avoid radioactive iodine and thyroid surgery. And there might be some people here who already received it. I know with past chats, past Q&As, we've had people who already received radioactive iodine thyroid surgery, and obviously, you can't undo that, but and there's good reason for some people to receive conventional treatment methods. Hopefully you can still hear me. I'm getting internet connection is unstable, even though I am hardwired. But anyway, even if you receive radioactive iodine thyroid surgery, obviously those didn't address the cause of the problem. So you still want to address the triggers, underlying imbalances. Maybe some people might want to avoid antithyroid medication, and some people are able to accomplish this. I was able to avoid antithyroid meds when I was dealing with Graves' disease back in 2008, 2009. But some people, everything's risk versus benefits. So some people do need to take the medication. And, so if you have to take it, don't feel bad about taking it. Think of it as temporary and just trying to be safe while you try to address the cause of the problem. So yeah, you want to be safe while addressing the costs. All right, so as far as your next health action step, so again, making a decision between antithyroid meds and bugleweed, that might be what, again, some of you already made that decision. Some of you are taking bugleweed. Some of you are taking antithyroid medication. And I work with patients, a lot of patients who are taking antithyroid medication. I never try to sway them to stop taking it, because either way, even the bugleweed is not it's not addressing the cause of the problem. It's just helping to lower the thyroid hormone levels, helping with the symptoms, while once again, you address the cause of the problem. Maybe for some people, their next health action step might be cleaning up their diet. And of course, eating well is important. I think everybody needs to eat whole, healthy foods, but just keep in mind, food isn't a trigger in everyone. So if you've been following a healthy diet, whether it's an autoimmune paleo diet or a regular paleo diet or a ketogenic diet or whatever diet you've been following, and if you haven't received optimal results, just remember that food, it's important to eat healthy. You don't want to eat an inflammatory diet, but even there are people who follow autoimmune paleo diet for a few months. I've had people 6 months or longer where they follow autoimmune paleo, and it's not meant to be a permanent diet, but if someone's not receiving results after a certain period of time, arguably after like 3 months, then we could maybe make that argument that food isn't at least isn't the only trigger, and you might have to look elsewhere. What are you doing to deal with stress? And especially true these last few months, but even before the COVID situation, there's always stressors to deal with, and most people could benefit from working on stress handling. Are you getting sufficient sleep? For a lot of people, the answer is no. For some people, they're trying, but struggling to get sufficient sleep. Have you done any type of testing to look for triggers? Maybe just some simple blood testing, but sometimes you need to go deeper. Actually, many times, like doing things like saliva testing, adrenal testing. It doesn't have to be saliva testing, but I've been doing saliva testing for years, and there's dried urine testing. Some people need a comprehensive stool panel, organic acids testing. There's Yeah, so it depends on the person. I don't recommend all those tests to everyone. That's part of the reason for doing like a health history. And again, blood tests, saliva testing, stool testing. All right, so one other thing I wanted to mention before we get to the questions, and that's pretty much what this chat's about. For those who are new, I'm just going to go probably like an hour or so, maybe an hour and 15 minutes just to answer your questions. And so, but I want to let everybody know about a hyperthyroid challenge that I'm starting on June 8th. So in April, I did just a general thyroid, like a thyroid immune health challenge that focused not on hyperthyroidism, but anyone with a thyroid imbalance or autoimmune thyroid condition. Actually, I did focus more on thyroid autoimmunity, but some people without autoimmune thyroid conditions joined too. But this is going to be specific for hyperthyroidism, so Graves' disease, toxic multinodular goiter, subacute thyroiditis. And again, it starts on Monday, June 8th. And so the goal is to help you avoid radioactive iodine while showing you how to find and remove your triggers. So this is a 21-day challenge. The last one was 30 days, but pretty much it's yeah. Anyway, so 21 days is still a good amount of time. So there will be 21 video lessons on overcoming hyperthyroidism, 21 daily priority action steps, live 30 to 45-minute coaching calls, 5 days per week. Probably like Monday through Friday, and probably closer to like the 45 minutes just from in April. I said it would be 30, 45 minutes, and it was, usually not 30 minutes. Also weekly 90-minute Q&A sessions. So the Q&A sessions just are longer, but you could also email questions with the Q&A sessions. And then I'm going to rotate the time. So like in April, it was just at 8 o'clock Eastern time. But just to try to accommodate people in different time zones, I'm going to be doing them like, let's say 3 a week at 1 p.m. and then 1 at 9 p.m. If I do a Q&A session in the evening, it'll probably be 8 just because I'm going to be going probably, even though it says 90 minutes, it'll probably be like 2 hours. But when I do the 30, 45-minute coaching calls in the evening, it'll be at 9 o'clock. Again, I know there are people on the West Coast who last time when I had it at 8, that was a little bit too early for them. So that was 5 o'clock their time. And there's also going to be a community. So last time I had a community on, so kind of like a group, I should say. So I had on what's called Kajabi, which most of you aren't familiar with, just because a number of people said they didn't want Facebook group. What I'm doing here, I'm actually going to have 2 different groups, one on Kajabi, one on Facebook, just really just testing it out and see, just because Kajabi, we did have a lot of people join and engage. But it did have some limitations, and I surveyed people at the end of the last challenge, and probably about 70% said they would do Facebook. But I know there's also people who won't do Facebook, so I'm giving both options. I mean, honestly, even if you didn't, not everybody joined the community, and they still got great benefits. If you visit, well, let me just say, so the cost of the challenge is going to be $49, and if you want to learn more information, you can visit this website, overcominghyperthyroidism.com, and you can see there's a video where I pretty much interviewed a lot of people, a few dozen people that participate in the challenge. They could hear their experience. And anyway, so that's pretty much it. Just wanted to let you know about that for those who are interested. Oh, and one other thing, there are 5 pre-training videos. So if you join, I mean, again, it doesn't start until the 8th as far as the live coaching calls and the daily lessons and priority action steps. If you join, whenever you join, if you join today, if you join next week, you get access to 5 pre-training videos. So like one talks in greater detail about symptom management, and anyway, it's on the webpage, so on the Overcoming Hyperthyroidism. So I'll stop talking about that so we could get to your questions. And all right, so so if you have a question, just type it into the chat box. Like I said, we're going to be sticking with the chat just because the last few times I've done it, even with the chat, we didn't get to everybody. So All right. So least, okay. All right. So if someone asks me about if, yeah, some people message, and again, I won't say new with Zoom because when I did the 30-day challenge in April, that's what I used, but still get used to some people when they message me privately. Most people send it to everybody. So if you message me privately, I'll try to remember not to say your name, but I'll still read out the question. So question is, can we talk about radio frequency ablation for thyroid nodules? I'm going to Mayo Clinic to see if I could get this done. So I don't know if you saw, I did, if you check out, maybe this is why you're asking, but the latest blog post that I have where I spoke about toxic multinodular goiter, I spoke about radio frequency ablation as well as laser ablation and ethanol injections. So different types. So the radio frequency ablation, as of now, I've only had one person go through it. I haven't followed up like I think immediately it seemed like it helped, but it's anyway. With the getting tongue tied here with all these with the ones and I talk about this in a blog post on toxic multinodular goiter. So it seems, I mean, it could be a good option. That's why I mention it. It depends on the person and the nodule, but also just keep in mind it's not doing anything to address the cause of the problem. But yeah, I'm not sure what specific questions you have. It's from what I understand, like compared to laser ablation, the radio frequency ablation, I mean, both of them, the side effects are minimal from what I understand. Again, I can't say I'm an expert with them. I did research for the toxic multinodular goiter blog post, but I can't say like I said, I've had up to now, I've had one person go through the radio frequency ablation and seem to be successful. I don't know long term about, as far as like her case, if it, if she did like a follow-up ultrasound to see, let's say like 6 months later, make sure that they didn't grow back, because there is always that possibility. And what radio frequency ablation, the advantage is that only one treatment is usually necessary. Sometimes with laser, multiple treatments are necessary. So, but if you haven't checked out that blog post, again, it's the one that's 2 weeks. I typically release my blog post on Thursday, and it was 2 weeks ago. All right, so Gail, her question, I was diagnosed with Graves' disease and I've gone into remission twice using methimazole for 12 months each time. I had normal thyroid results after each 12-month period. After my first try, my TSH went to 0.02, and after second try, it went down to 0.04. How to prevent this from happening? Should I take bugleweed after stopping the methimazole? Yeah, so when you say like you're after first try, so I assume you mean after the 12, you said you had normal thyroid results after each 12-month period. So are you talking about like, I'm not sure if you mean that your thyroid hormone levels were normal, but your TSH was still low each time, or if everything was normal and then after a while your TSH went depressed. But just so if I mean, just keep in mind, I guess the best thing to talk, in my opinion, it's important to talk about addressing causes, because the methimazole and the bugleweed, both of those are just for symptom management. So if you took methimazole, you took it twice for 12 months, and then everything normal, or at least again, thyroid hormone levels normalized. And like I said, I'm not clear on the TSH if it normalized, but then became depressed again, or for never. I mean, TSH does take a while to increase. So that wouldn't be a surprise, but most doctors won't take someone off methimazole until the TSH is looking good. So if I had to guess, I would guess that your thyroid hormone levels and TSH were fine, but then your TSH became depressed again, and then you went back on the methimazole, maybe thyroid hormone levels got high again, or maybe not. Maybe the doctor just gave it based on the TSH after doing a follow-up blood test. But just remember, you want to ideally address the cause of the problem. I mean, start with diet, lifestyle factors first. So that's like, as I mentioned, food's not a trigger for everyone, but stress is a big factor with a lot of people. You're not going to get rid of stress, but you could do things to improve stress handling. Again, testing very well might be necessary, not only blood tests, but I do adrenal testing, nutrient testing, sometimes comprehensive stool panel, sometimes other testing. So as far as should you take bugleweed after stopping, methimazole, I mean, the bugleweed, if you could take it to keep the numbers in check, but it's not going to resolve the problem. And also the antibodies, I would also look at antibodies, because you want to ideally see the antibodies normalize after it's a little, not always when getting off methimazole, because sometimes, again, if someone's on the hypo side and their antibodies are still positive, then first of all, most endocrinologists aren't really paying attention to antibodies, but you still ideally want, if the antibodies are elevated, thyroid stimulating immunoglobulins, TSH receptor antibodies, those, so if those are elevated, if the antibodies are elevated, then that's pretty much saying you're definitely not in remission, and that frequently is the case. So yeah, I would say definitely try to address the cause of the problem. And then Robin has a question about, eyes feel weird in the mornings. How do I know if I have exophthalmos and if it's in active stages? Yeah, so if it's not visible to you or others, but usually the person who has the bulging of the eyes is usually they notice it. Others, like close family members, might also notice it. But if you don't notice it, if people, friends and family members, you could ask some. A family member who's close probably would say something. A friend may not, but you could always ask. But if it's not detectable, that's good. But if you have other symptoms associated with thyroid eye disease, probably the best way to know if it's active is, if it's fairly recent, it most likely is active. But you could also go to an ophthalmologist. They could do some measurements and just measure the bulging, the proptosis, and they should also be able to let you know if it's an active stage. But if it's the active stage usually lasts the first years. It could last a couple of years though. So if you've had it for like 5 years, it's probably not active. If you had it for a year or 2 years even, it could be, especially that first year. But if a lot of people with thyroid eye disease, to get it further evaluated, they'll go to an ophthalmologist. Hey, Judy. First time on YouTube chat. Yeah, actually. Oh, wow. There's a number of comments. So for those on YouTube, thanks for a reminder here. So I'm going to be going back and forth. So I forgot to, again, I usually don't go back. When I did the 30-day challenge, it was just Zoom. So I've done this Zoom YouTube thing. This is, I think, the third time. But yeah, just a few people on YouTube put their typed in where they're from. So Jan from Tuscaloosa, Alabama. Ruth outside of Philly. Adarsh, Las Vegas, Nevada. Sue from Canada. Someone else from Glen Allen, Virginia. All right, so we'll get to the YouTube comments in just a few minutes. So I'll go back and forth. But yeah, sorry guys, those on YouTube. I got caught up with the technology and then with Zoom. But let's see. So Rick, do you think hypothyroidism is caused by EBV, which is Epstein-Barr virus? Some cases could be. I know there are some out there that think that Epstein-Barr is the cause of most thyroid and autoimmune thyroid conditions. Including, even though the topic here is on hyperthyroidism. But regardless, there are some that, but yeah, I definitely don't agree it's the main cause of all conditions, whether it's hypo or a hyper, but it could definitely be a trigger, and it is in the literature, Epstein-Barr. A big factor is interpreting the test. The interpretation of testing when it comes to Epstein-Barr has changed over the years. And just a few years ago, most practitioners will look at the antibodies for Epstein-Barr, and there's 4 that you look at, and there's a blog post I've written on this. But but IgM, as in Mary, if those were elevated, then we would assume that it's active, which still is the case. If someone has Epstein Barr or cytomegalovirus, and any virus that's IgM, that means it's active. And if it's IgG, we would assume that the person has it in their body, but it's inactive. But that's not always the case. If the IgG markers are really high, especially if someone has like 2 out of the 3, that's really high, or all 3, that's really high, like in triple digits, then it could definitely be causing problems. But to answer your question, Rick, no, I don't think all cases of hypothyroidism or hyperthyroidism is caused by Epstein-Barr. All right, so Judy says, for stress, walk in nature and feel immense gratitude. Yeah, that's just some basics could go a long way as well. All right, so Estella, gut health, pH trigger by stress. So I'm not sure if you had a question with that or if you're just making some comments, but so Judy, question here: how do you know if you go from hyper to hypo? Reduce methimazole and not taking bugleweed now, low blood sugar and tiredness now, hyperthyroid challenge, I already had one. Yeah. So what was I going to say? So yeah, I mean, symptoms, I mean, the fatigue could be due to, like, if someone's taking methimazole and they weren't fatigued and then they start becoming fatigued, that definitely could be a sign. Or other symptoms like getting cold hands and feet, that would be a indicator that the thyroid's too low, or gaining some weight. The methimazole has a tendency of making people hypo on a temporary basis, and it depends on the dosage. But symptom-wise, many times someone can tell, not always, and obviously the blood test, eventually getting another blood test will reveal. But if you reduce the methimazole, then again, maybe that will help. And if you felt on the hypo side and then reducing the methimazole kind of normalizes things, but eventually you'll do another blood test and you'll see what that blood test shows, and that'll tell you where you are as well, and if you need to further lower the methimazole, or if you're good to go for now where you are. Okay, so Chanel, question, she has Graves. What can I do about my goiter and bulging eyes? So goiter, then again, that's a swelling of the thyroid gland, and it could be, there's hyperthyroidism can cause that, or hypothyroidism. So when I was dealing with Graves' disease, I had a mild goiter, and it really wasn't noticeable as far as people being able to tell. But when I swallowed, especially like fish oils, it would get lodged in my throat. And sorry, just making sure it's still recording on Zoom. Yeah, so lowering the thyroid hormone levels, in my case, balancing out the thyroid, that helped resolve the goiter problem. If someone has low thyroid, same thing, just increasing the thyroid hormone. They might have to take like levothyroxine, like thyroid hormone replacement. But of course, we're talking about Graves and hyperthyroidism on this chat. So if it's, but some people again are taking antithyroid medications such as methimazole or PTU or carbimazole if you're overseas, and that could make someone hypo and also cause a goiter. But so lowering thyroid hormone levels, and then just overall improving, reducing inflammation. And then with the bulging eyes, so remember, with thyroid eye disease, it's an immune system condition. It's the same autoimmune component that's responsible for Graves. So what you want to address the immune system. And as far as will the eyes go back to normal, it does depend on the severity. If someone has mild to moderate bulging eyes, then there's a good chance, especially on the mild side. If it's on the moderate side, kind of a toss up. But if it's severe, you might get some changes, but it's probably not going, at least not with following a natural treatment protocol. If someone has like severe bulging eyes, it's probably not going to go back to where it is. But there is now Tepeza, a new medication for thyroid eye disease. And I've written a blog post, I think it was maybe it was in March. It was April or March. It just came out this year. It's been in trials for a while. And that seems to help. I actually have one person going through the Tepeza infusions. It's 8 infusions, 3 weeks apart. So he's been through 2, and so far he says, that it seems like it's helping with the bulging, but he also has some double vision, and it's not helping with so far it's only been 2 infusions, but he hasn't noticed a difference with the double vision. But again, he has 6 more treatments, but he thinks already it's helping with the bulging. But yeah, so Tepeza might be, I mean, it's obviously, if you want to try to do it without taking the Tepeza, and Tepeza, from what I understand, is outrageously expensive if you don't have health insurance that covers it. But again, everything's risk versus benefits, meaning, of course, if you can't afford it, if you don't have health insurance, and I don't know what the cash price is, but if you have health, some people, even if they have health insurance, they might want to try to avoid it because it's a medication, and it's also not the most convenient since you have to go for the infusions, even though it's only 3 weeks. But again, risk versus benefits. If someone has severe thyroid eye disease and debilitating diplopia, double vision, then Tepeza might be the best option. Because if it's severe in the past before Tepeza, really assuming someone didn't respond to natural protocol, the only option was surgery. So at least it is another option. And looks like Annette has the same question. I don't know if you had the same question about both the goiter and the bulging eyes, but either way, hopefully that answered your question. All right, so David, chronic microwave exposure from wireless tech, Wi-Fi routers, and pending 5G can trigger hyperthyroid conditions. Much science out there. Just do a search and you will find it. Yeah, there's actually I sent an email on a 5G summit that's taken place in June as well. So I mean, 5G, just electronic pollution, which I talk about in the challenge. Again, I did a similar challenge in April, but this one focuses on hyperthyroidism, and there's a call which I just focused on electronic pollution, 5G, and EMFs. But if you want to learn even more, like you said, you could do some searching. But the summits, I attended last year the 5G summit, and then I attended an EMF summit by what's his name, Lloyd Burrell, I think. Anyway, from I forgot his name. Anyway, but yeah, both summits were amazing. So yeah, thanks for adding that, David. All right, so Joe, I have been advised that low dose naltrexone can calm autoimmune conditions like Graves' disease. I do think it calms my overactive thyroid gland, but it affects my sleep. What are your thoughts on LDN for Graves? So LDN, low dose naltrexone, like you said, it can potentially modulate the immune system, which is great when it works. The problem is it's more hit or miss. That if LDN worked on most people, I think it would be a better option than antithyroid medication because side effects are not as common. I mean, it can affect sleep, like you mentioned. I'll mention that in a minute also, but antithyroid medication could put stress on the liver, could depress white blood cells, can cause other symptoms at times, not with everybody. Again, risk versus benefits. So if you're taking antithyroid medication, which a lot of people are, and a lot of my patients do, but truth is that LDN has less side effects, but it's more hit or miss. A lot of people take it and it doesn't really help. But if it modulates the immune system in someone with Graves, and if it's effective in doing that, it could. I don't want to say take the place for antithyroid medication, but essentially they could take that instead of antithyroid medication. But since it's more hit or miss, like methimazole, PTU, antithyroid medication, more likely to cause side effects, but they almost always work. Again, there's always exceptions, but most of the time they work. LDN more hit or miss. And yeah, that's the one downside I know of what LDN is, the sleep. And some people, I mean, usually they recommend taking it at night before going to bed. And so as a result, some people take it during the day, but even some people that take it during the day still experience, still have sleep problems, and even with obviously LDN, low dose naltrexone, it's low dose. So a lot of people just starting with like 1.5 milligrams. they still have some sleep problems. But if you're taking it at night, definitely would, try to take it earlier in the day and see if that helps. And if not, that I'm not sure. Again, it's great that it sounds like it is working with you, just by calming down your immune system, and that's preventing the immune system from attacking the TSH receptors, and that's calming down, like you mentioned, it's calming your overactive thyroid gland, but it's doing that by helping to modulate the immune system. But the sleep is, something I don't have an answer for if someone's taking it, other than change the time of day. But if that's still a problem, then I am not sure. But yeah, I've had a good amount of people on LDN, and I've written some articles on low dose naltrexone as well. All right, so Denise, I lost sense of smell and taste. The fourth doctor took me off of methimazole, then put me back on it. So I'm not sure if you are, I don't know what the question is, if it was due to, if you're saying that it was due to the methimazole and then you were taken off and then that came back. Yeah, so if you have a question, Denise, on that, let me know and I'll try my best to answer it. All right, so Bianca, do you recommend a certain diet for Graves' disease? So usually I start people on autoimmune paleo diet, and I have some nutritional health coaches working with me. So usually they're the ones, I'll give some diet information, but they go into more detail. But it depends. It does depend on the person. Like yesterday, I had a new patient who with Graves' disease, but she also has SIBO. She tested positive for small intestinal bacterial overgrowth. And so someone with SIBO needs a different diet, like a low FODMAP or SIBO biphasic diet. But either way, it's too restrictive to follow autoimmune paleo and a SIBO diet. So with her, we're focusing first on the SIBO. And if someone's a vegan, vegetarian, autoimmune paleo is challenging to follow. So more recently, what I've been doing, some of you might be familiar with Dr. Stephen Gundry. He wrote a few good books. One of them called The Plant Paradox. So he believes in more of a plant-based diet. And I think AIP, autoimmune paleo, I think should also be more of a plant-based diet. It doesn't mean you want to load up on the meat. You still want to eat a lot of plant-based foods. But Gundry recommends also plant-based, but more plant-based, more on the, I guess, vegetarian side. But he acknowledges that there's problems with legumes and nuts and seeds with the lectins. So he does allow more flexibility with the diet compared to autoimmune paleo. Like legumes are allowed, pressure cooked, certain nuts are allowed, walnuts, pecans, pistachios, macadamia nuts. Pretty much all grains are limited except millet, I think, is the only one. So, but if someone's a vegetarian, ideally in a perfect world, autoimmune paleo, but it's too strict if they're not eating, especially if someone's vegan. Regardless, even if someone's vegetarian, it's still, either way, it's really difficult. If someone's pescatarian, they can eat fish, even that's restricted, but still that makes it a little bit easier to follow autoimmune paleo. But it's a starting point. As I mentioned earlier, diet it's important to eat well, but it's also, you can't, food isn't the only factor in many people. So there are some people, that's all they do is clean up their diet and they get great results. Or some people, all they do is avoid gluten, maybe dairy, and get great results. But then there are some people who follow strict autoimmune paleo, and that's not enough. But so thanks for your question, Bianca. All right, so this is a private message, so I'll go ahead and read it, but not mention the person's name. So my question is, how do you manage overactive thyroids as well as having high iron levels? So I am on propranolol, which is a beta blocker, and carbimazole, but very keen on treating this naturally. And then can turmeric help with both hyperthyroidism and inhibit the absorption of iron? So as far as managing, like symptom management, it's pretty much either someone's taking the medication like the carbimazole, or here in the United States, it's typically methimazole or Tapazole. And then the propranolol is more cardiovascular symptoms. But if someone wants to take a natural approach, usually bugleweed and motherwort, higher doses of L-carnitine, like 2,000 to 4,000 milligrams per day, also has antithyroid properties. Lemon balm has some mild antithyroid properties. And there's some other agents, but usually I start off with bugleweed, motherwort, and turmeric. I mean, turmeric could help with Graves, like the autoimmune component of turmeric has some amazing benefits. Or, again, thyroid eye disease. And again, just taking turmeric alone isn't, keep in mind, it's not getting rid of the trigger. So a lot of people take turmeric, curcumin, and some people notice a difference, some people don't. Some people need higher doses than what the bottle says. The bottle might come in 500 milligrams of curcumin, and they might need a few thousand. But like I said, it's not addressing the cause of the problem. And then, yeah, I don't know about turmeric inhibiting the absorption of iron when it's high. I mean, having high iron levels, yeah, I mean, you could give things that affect mineral like chelate minerals, but I usually don't do that because there's nothing I know of that's just specific to iron. So if you give, something like a mineral chelator, which again, I don't think turmeric does that, but maybe it does. But I mean, usually if someone has high iron levels, of course, we want to figure out why. If it's hereditary, then they probably need to have a phlebotomist or, donate blood on a regular basis. If someone has like hemochromatosis, there's, like if someone has iron deficiency, then of course you could take iron or do things to increase iron absorption. If someone has increased iron levels, again, I'm cautious about trying to do things to decrease iron absorption, like because it might affect other minerals. But so, like I said, hemochromatosis, usually like a phlebotomist or just regular blood donations. And then just if it's not hereditary, then what's causing the high iron? Is it is someone taking iron, which I mean, sometimes that could be the case. Sometimes it's a fluke too. Or I mean, I've had a few people do a full iron panel where it's high, and then 2 months later it's normal. So again, if it's high one time, I would probably say to do a retest, just to make sure that is the case. But and then also, this is important too. Keep in mind that ferritin is an acute phase reactant, which means so ferritin is that relates to iron stores, and it increases in regards to inflammation. So increase, if you just have ferritin alone, and if it's elevated, that doesn't mean you have iron overload. You want to do a full iron panel. You want to test serum iron, and you want to test iron saturation. All right, I'm going to get to some of the YouTube. There's not a lot of YouTube comments, but just want to give the YouTubers a chance. And yeah, hopefully, all right, I think the screen, YouTube just looks a little weird with the, yeah. Anyway, so just yeah, when I look on YouTube, it just doesn't seem like it's showing the screen share. So I'm not sure what, but yeah. Anyway, so all right, let's see. So Ruth Graves, since 2012, in and out of remission. What are your thoughts on people with Graves and other autoimmune diseases and vaccines like shingles, potential COVID-19? I got 2 shingles vaccines recently. Yeah, it's definitely controversial. As far as don't want to get into too much detail about vaccines, but there is evidence. I mean, there's nothing specific I know of with Graves and vaccines, but I mean, just the problem with the vaccines are the chemicals that are in the vaccine. So again, it's I'm sure there are some people that are attending this, like waiting for the COVID-19 vaccine. Can that be a potential trigger? I mean, yeah, I mean, possibly, but yeah. So I've written actually, well, not on shingles, but I did write, I wrote an article on shingles, not the shingles vaccine, but I did write an article on the flu shot, just because a lot of people have the flu shot. And the goal really wasn't to tell people not to get the flu shot, although, I've never gotten the flu shot, and, I don't, it's, yeah, I mean, there's different strains of the flu, and they even talk about that with COVID-19 as well. So I'm not sure how much, even if they come out with a vaccine, which is questionable, I don't know how effective it'll be. But yeah, as far as people with autoimmune conditions getting vaccines, or again, that's probably, I guess that's more your question. And again, I'm not sure. Yeah, like I said, I even before Graves, I didn't really, I wasn't a regular, getting the flu shot. And when I did get shingles a number of years ago. I didn't get the shingles vaccine, but again, it really wasn't based on the concern just with autoimmunity, but just other things associated with, like, again, the ingredients in the vaccine. And but yeah, there is a risk. I mean, if you're wondering if there is a risk of taking it, there is a risk. I'm sure there's a lot of people who get the flu shot who have autoimmune conditions, and they do okay. So it doesn't mean that everybody who has Graves or another autoimmune condition is going to have problems getting vaccines. But yeah, so I mean, everything's risk versus benefits. And yeah, I mean, it's, again, I don't, the flu, to me, the flu vaccine, just doesn't make sense, just because there's, different strains of the flu, and they only have like two types of the flu vaccine, or maybe three per year at the most. So it doesn't guarantee you won't get the flu. But anyway, and something, we could go back and forth on, which, but let's get to Sue here. So glutathione is known as a great antioxidant. Do you recommend that supplement for someone who has Graves' disease? I mean, I'll commonly recommend NAC, N-acetylcysteine, which is a precursor to glutathione. But there are some times when I will recommend a liposomal or acetylated glutathione. Liposomal, most liposomal glutathiones don't taste really good. But yeah, so yeah, so it's not something I wouldn't say I recommend to everybody to take a glutathione supplement. But a lot of times I'll give like N-acetylcysteine to support detoxification. All right, someone here, I'm having trouble getting the doctor to test me at all. I really want to go on the natural journey with my hyperthyroidism recovery, but I'm getting no help. I added half a dropper of motherwort, working great. So far, we'll go up a full dropper once I get more. Yeah, so remember, motherwort is more for like the cardiac symptoms, like heart palpitations, for example. Bugleweed is more specific for for lowering thyroid hormone levels. So yeah, just yeah, so those, they have two different functions. And then, if you're not getting the testing, I mean, of course, you could consider, depending on where you live in your situation, maybe switch doctors. But besides doing that, you could just start with diet, lifestyle. So clean up your diet, block out time to manage stress, make sure you're getting sufficient sleep, and again, not to plug the Overcoming Hyperthyroidism Challenge, but again, for those who are looking for more guidance, and especially those on a budget, you might want to consider that, which doesn't look like it's showing up on the YouTube thing. Let me, just for those on YouTube, I don't know if they've actually seen this, but it was, because it looks, at least on my view of YouTube, looks kind of funky. Maybe it's just my view, but last couple of times I did this, it showed the slides on YouTube as well. But all right, so let's get to another question here. So Aspria, oh yeah, there we go. So now it's showing on YouTube. I don't know what was happening before on YouTube, but all right. Have you considered creating courses for providers? I believe tests like organic acid tests as well as saliva cortisol are valuable, but can be confusing. Yeah, I've thought about it. It's just the time, honestly. I mean, my dedication is with the, my patients and other people that are, so I mean, eventually, maybe, but again, just like I want to do a podcast that, honestly, I want to do a podcast, and I am going to do a podcast. I just keep on, like, I decided to do the Hyperthyroid Challenge just to help with patients, and the podcast just to also as a free resource. Um, so maybe in the future, something for providers. It's just the time, just trying to prioritize, and again, just yeah, I don't want to take time away, anyway. So there is a website. I have created, and again, this wasn't really for providers, for practitioners, but there is another YouTube channel. So the YouTube channel that I'm doing this chat on, that I'm live streaming through Zoom. This is my Natural Thyroid Doctor YouTube channel, but I created another one, Understand Your Tests. If you go into YouTube, if you're in YouTube, you could do a search, or you could visit the website understandyourtest.com, and there are video tutorials where I discuss the organic acids test and I discuss saliva testing. It's the reason I put that together are, again, those who might not be able to afford to have a doctor go over the results, and it's not exactly the same, but at least it gives some guidance. And the same thing, that the reason I'm doing the challenge is just, again, just to give some support, and also I'll be going over that in greater detail. But yeah, like I said, so maybe in the future I'll do something specific for practitioners. I just have a hard time keeping up with everything, with between my patients and writing articles, and just the videos. The one I just mentioned, I've taken a break from that just because I couldn't keep up with that, because I'm focusing on the hyperthyroid challenge, the overcoming hyperthyroidism challenge. And yeah, so that's going to be a priority for June, and then hopefully after that, the podcast. So all right, and then all right, so Ashley, wondering what foods are the worst food for people with Graves' disease. um Sorry, I was looking at someone else's yeah, so I mean, just what for Graves, I mean, just I would say, I mean, there's not really a food that I would say is work. I mean, just generally, I would say avoid. I mean, some would say like nightshades, which is part of, like, if you follow autoimmune paleo, you'd be avoiding nightshades, but not just for Graves, but for, some would say like seaweed because of the iodine. So that's controversial as well, which someone actually asked about iodine. And definitely a lot of controversy with iodine and thyroid health in general. So again, if someone has specific questions with iodine, I'd ask, but someone just asked how about iodine, and again, that's I could easily spend like 30 minutes talking about iodine. So if you have specific questions, definitely let me know. But yeah, what foods I would say definitely avoid, which you probably already know. Most people know, avoid the refined foods and sugars, the fast food. Um, just try to stick with whole, healthy foods, even if you're not following autoimmune paleo. Just again, just whole foods, plenty of vegetables. Again, mostly plant-based. Even if you are a meat eater, like I do eat meat, but I don't eat meat 3 times a day. Now, some people are following autoimmune paleo. They are eating more meat just because they feel hungry otherwise. But just remember, you in the long term, you want to eat plenty of plant-based foods. All right, and then so Eva, can I have fish or iodine for hypo and goiter? So I mean, fish, yeah, I mean, probably want to eat like wild salmon, sardines. I mean, I wouldn't eat a lot of fish. I know some, like Sarah Ballantyne, says the opposite, but I still would limit the fish to a few times per week, 2 to 3 times per week. And then iodine, again, very controversial. So I would say, if you have an iodine deficiency, maybe, and even that, if someone has Hashimoto's, iodine deficiency is not the cause of the Hashimoto's, but if they could solve an iodine deficiency. But, and again, I don't want to get off. This is more focused on hyperthyroidism. But even with like Graves' disease, iodine, even though iodine is important for production of thyroid hormone, taking higher doses of iodine can suppress thyroid hormone production. So in some cases, it could be used as a treatment to manage hyperthyroidism, but you don't never know how someone's going to respond. Some people will, they might become more hyper, might exacerbate the autoimmune response. And again, I'm more pro iodine. So if it sounds like I'm anti iodine, I actually, when I was dealing with Graves, I actually did take iodine under the guidance of someone I was working with, and I did well with it. And so for a few years after, I would commonly recommend iodine. Testing. I would have people do a urinary test for iodine, and if they were deficient, make sure to take like selenium and magnesium and vitamin C and start with low doses. But some people still didn't do well. So that's not the approach I take now. I mean, if someone wants to talk to me about iodine, like a patient, during a consultation, of course I will, and they could do testing. But I think it's important to have healthy antioxidant levels, because that's one reason why a lot of people with iodine don't do well. Or a lot of people who take iodine don't do well, just because they have low antioxidant levels, and that's why the practitioners will say to take selenium and vitamin C, and but it can, doing that alone isn't always enough. Sometimes you have to take more time, build up the antioxidants like glutathione, someone mentioned, which selenium is a cofactor for glutathione, and vitamin C helps with the recycling of glutathione. And yeah, maybe someone needs to take, in this case, like a glutathione supplement. All right, motherwort didn't work for me. My doctor gave me atenolol, which is again a beta blocker. Yeah, so again, the bugleweed, motherwort works probably like 70-75% of the time, but for some people, it doesn't work well. All right, let's get back to the Zoom. Some of the Zoom questions here. Okay, and I'm gonna go like another half hour. All right. Yeah, I'm probably not going to get through all these questions. There are a lot of questions here, so I will try my best. And all right, let's see. Just trying to see where I left off. So Linda, I'm going to start just making sure I get to everybody at least one. So Linda, I don't think I answered a question from you. What natural remedies counter hand tremors? I mean, when I was dealing with Graves, it wasn't severe, but I had mild hand tremors, and that seemed to be related. Again, it's common with the high thyroid hormone levels. I mean, that's so increased heart rate, palpitations, and tremors. With me, it was more like when I remember when I had blood draw. To get my blood drawn, I had noticeable tremors most of the time. But lowering thyroid hormone levels, just if you have to take bugleweed and motherwort, then if you're taking, let's say, I mean, if you're taking anti-thyroid medication, I would hope that it's helping. But if you're taking more of a natural approach, and maybe you're just taking bugleweed, and again with bugleweed, sometimes it doesn't work, not because it's not working, but because someone's not taking the appropriate dose, because the potency is not high enough as well. But some people, like in my case, I was taking, I took MediHerb, like a 1 to 2 extract for the bugleweed. I was taking a teaspoon twice per day. I'm mentioning this just because I know some people will ask, like, how much do you take? And it depends on the person. But that still wasn't completely knocking out the heart palpitation. So then I added motherwort in my case. But again, so that's usually with the hand tremors associated with hyperthyroidism. You want to manage the hyperthyroidism, lower the thyroid hormone levels. Okay, so Amishi, again, I hope I'm pronouncing your name correctly. So I've been diagnosed with Graves' disease. I was recently on methimazole 30 milligrams Monday through Friday for 7 days, and methimazole 15 milligrams Monday through Friday, and 10 milligrams on Saturday and Sunday. Okay, I'm not sure if I follow you. So I've been talking, I was recently, so I guess you are recently on methimazole 30 milligrams for 7 days, but now you're on methimazole 15 milligrams Monday through Friday and 10 milligrams on Saturday and Sunday, as I assume what you're saying. My TSH is less than 0.006, free T4 1.92. I've been experiencing more headaches recently since my new medication regime or regimen. Tightness in my head. I also experience pain and discomfort in the back of my eyes. Is there anything I can do to help these headaches and discomfort? Thank you. I am pescatarian. I follow a high protein, low fat diet, and at times my thyroid swells. I wonder what is triggering this. So, I mean, free T4 at 1.92 is high. I mean, it's definitely not like crazy high, but I'm wondering what your numbers look like on the 30 milligrams of methimazole. I mean, that's a pretty dramatic decrease. So I'm guessing if you are, um, yeah. Anyway, so yeah, and I'm not 100% sure because you said 30 milligrams Monday through Friday. Um, yeah. Yeah. So anyway, so I don't know if you aren't taking anything on Saturday, Sunday, because then now you're taking 50 milligrams Monday through Friday and 10 milligrams on Saturday, Sunday. I don't know if the endocrinologist knows, what he or she is doing. Which I had this conversation. Was it? I forgot if it was today. I think it was yesterday. Like, just you would think going to an endocrinologist, they would, but a lot of them don't deal with hyperthyroidism. A lot of them deal with diabetes, and Hashimoto's is a lot more common than Graves' disease. Hyperthyroidism isn't as common. So yeah, so it sounds like that person might have, even if you are on the hypo side, maybe decrease the dosage a little bit too much, where you're going from 30 to 15 milligrams. Again, I mean, I could understand if you are super hypo, which I'm not sure if that was the case. But if you have been, so you've been experiencing more headaches since the decrease. But again, you just mentioned your TSH is depressed, free T4 is high, free T3 probably is high. So I mean, to me, I would say in order to, address at least some of these, you say also discomfort in the back of the eye. So remember, it's immune system based too. So you want to, from a symptom management standpoint, maybe you need to take more methimazole, or you could take, add some, if you're not taking motherwort, or if you're not taking a beta blocker with the methimazole, maybe add some motherwort. So this way you have the methimazole helping with thyroid hormone levels, even though it looks like maybe not doing enough. But then you have motherwort, but then also do things for the immune system, address the autoimmune component. There's plenty, so besides, the overcoming hyperthyroidism challenge I'm having, where I'll go into greater detail with the triggers, there's also plenty of free stuff on my website too. So again, there's, and my book as well. I do. That's also another thing. Like, someone asked about me helping practitioners. So also on my list is coming out with a newer book on hyperthyroidism, which probably is not going to happen this year. I can almost guarantee it's not going to happen this year because I haven't started on it. But yeah. So point is, I mean, you can read my book. It's not a lot of the information still relevant. It's, but just keep in mind that it was last updated 2013. So there's a lot of information on my website since then too. So if if you have my book, read it. If you don't, definitely read it. But also keep up with the blog post. And then again, for the hyperthyroid challenge, all that's updated, just all of it from April. So so all of it, and it's more than 21. It's 21 days of video lessons, but some days have multiple videos. But either way, like I said, it's, try to lower the thyroid hormone levels and then do things to balance the immune system, which, like I said, is very general. But that's, as I mentioned, just at the very least, go back on, look at some of my past blog posts, read my book, just to do things basic from diet. You're doing, pescatarian, following a high protein, low fat diet, which I don't know. I mean, the low fat, okay, that actually, Yeah, I mean, not that I'm recommending to be ketogenic, which is the opposite, high fat, high fat diet, and then, low carb, very low carb, and also not high protein. But I would say, if you're eating a good amount of protein, that's fine, but also eat a good amount of fat too. I mean, I would hopefully like avocados, maybe have an avocado per day. If you're pescatarian, so you're getting some fat from the fish you eat. Okay, Sean T, is a daily moderate cup of coffee okay with Graves' disease, or would you recommend not drinking coffee? Initially, I recommend not drinking coffee, but sometimes I have to negotiate because there are some people that, I mean, gluten is something I would say definitely give up while restoring your health, just because it affects the gut in everybody. It's not everybody's sensitive to gluten, but in 2015, a study showed that gluten causes a leaky gut in everyone. So it is inflammatory. So I would say avoid gluten while restoring your health, which many people know. Coffee doesn't affect everybody in a negative way. But just if someone has problems with adrenals, which a lot of people do, coffee could drag down the adrenals. So ideally, I would say cut it out. But they're worse if someone's doing everything from a diet perspective, but they're only having a cup of coffee, or some will do like half and half, and hopefully like a good quality, like organic coffee, organic decaf, if they're mixing it, or just even if they're just drinking regular caffeinated coffee. But yeah, I mean, I usually will try to convince people to stop it, but sometimes it's not easy. I mean, if someone's drinking a few cups of coffee per day, it might be challenging. Even if someone's drinking 1 cup of coffee per day, it can be challenging. I've never been a coffee drinker myself, but my wife's a coffee drinker. So, and she doesn't seem to be really addicted. She just drinks a cup per day and enjoys drinking it. And for some people, it might not be an addiction. I mean, some people might be, tied to the caffeine, but for others, it's just that, that kind of makes their day. They look forward to the cup of coffee, and if they have that, everything's good. Everything else is good. But all right, so I'm going to skip over some people that I answered questions, just because I want to make sure I get to everybody at least once. And again, there are some people, maybe if I forget, and if I answer a question more than once, so be it. But so yeah, so this person, do you recommend iodine for okay, another hypothyroid, which I think this is, I might have answered this earlier. So it depends on the person with the iodine. So um, um, all right, so. All right, this is not a question, but a comment. So even though it relates to hypothyroid, so Dayton says, I had hypopituitarism and hypothyroidism. They were all over the place with Synthroid. It never worked for 3 years. I was reading about iodine and heard kelp and seaweed contains this. Allopathic doctors thought I was crazy, started taking it anyway. My energy is back and felt much better within 2 days. Yeah. So, I mean, iodine can do wonders for a lot of people, but that's the problem. You hear like like a lot of people might see this comment and they might say, oh, well, I'm going to try the iodine, but what works for one there's a blog post I wrote. If you visit my website, naturalenergiesolutions.com, and do a search, I wrote a blog post a number of years ago, what's your experience with iodine, just getting up, so you could see the mixture of people who took iodine and got great results, and others who took iodine and didn't do well. So yeah, definitely, like I said, I'm more on the pro iodine side, but I'm just very cautious, just because I've seen people where it does the opposite and flares up their symptoms. So all right, so I have a 2.8 centimeter nodule, which is mildly suspicious. I don't want the radioactive iodine. I don't know what else to do. Doctor wants me to take methimazole and then the iodine, and that's what I'm going to Mayo. My TSH is less than 0.10, and free T4 is 0.9, and free T3 4.4. I'm also wearing a heart recorder because of a light flutter. So this is the one that asked about the radio frequency ablation. Yeah, I mean, in that case, I mean, so it sounds, I mean, you don't have Graves, it doesn't look like, and obviously your numbers, if anything, at least your free T4 is on the lower side, but free T3. So yeah, maybe you have like toxic multinodular goiter, um, and yeah, the iodine. I mean, if I had a choice between radioactive iodine and radio frequency ablation, there's no question I would try the ablation. And like I said, I've only had one person do it, but it seemed like it was successful. And again, it's not, yeah, the radioactive iodine would, out of every treatment out there, it probably would be the last thing I would get. I would, again, it may be, and some would say, well, even before thyroid surgery, I mean, it's easy for me to say because I'm not facing that situation, but I definitely would get the radio frequency ablation because again, that's not over that or thyroid surgery or radioactive iodine. So again, hopefully some people might hear the radio frequency ablation and think radioactive, because when they hear ablation, some people. So again, that's completely different than radioactive iodine, which is swallowing a pill with radioactive iodine, and yeah, so that's so that it's like I said, it's I mean, I would also try to address the cause of the problem. I mean, 2.8 centimeter nodule, and then is large, and then he said mildly suspicious. So um, yeah, I would look into either like the laser ablation or radio frequency ablation. I would, like I said, I would do everything I can to avoid radioactive iodine in my case. So, and so ultimately it's up to you, but it sounds like you're on the same page. So, so Janine, I get massive joint pain. I have hypothyroidism and low sex drive, no period, 3 years, gain weight, and stomach is big for me in a small frame. 88 micrograms of synthroid. What can I do? So yeah, a lot of people popping in with hypothyroidism, even though it's a hyperthyroid chat. Yeah, I would look. I mean, definitely testing, so I'd look at adrenals, so this, even though it's hypo, this could apply to other people too. So if someone has low sex drive, you need healthy sex hormones. I'm sorry, you need healthy adrenals to have healthy sex hormones. So doing things to improve adrenals. But if you say massive joint pain and stomach is big, again, that could be adrenals too, but it could be SIBO, like SIBO, small intestinal bacterial overgrowth, could cause a lot of bloating and like the stomach, like you're describing. And then, I mean, also maybe the joint pain, but I know infections like Lyme disease, which I have experienced personally, so not as bad as other people when I was diagnosed with chronic Lyme in 2018, but again, joint pain, that it could be infections as well, especially if you said massive joint pain, and if it fluctuates. I mean, if it fluctuates, maybe Lyme, but it could be something. It could be another type of infection as well. Just going to take a quick sip of water here. Okay, Shansai, did you experience a sore throat when you had a goiter? If you're asking me, I did not. I did not have a sore throat when I had a goiter. Okay, so Elijah, my wife was just diagnosed with Graves' disease a month ago. She had given birth to our child a year earlier. Is there any chance that this post-pregnancy related to being a year out? Its appearance seems to be timed with a highly stressful period as well. In general, we're overwhelmed with what natural remedies to try first, or how long. Sorry. Okay, there we go. Or how long we should try each of them in order to identify a particular case. I know this is broad. I hate this message. Let me see what. Oh, there we go. Actually, that's better here. Sorry, I didn't know I could expand that Skype the Zoom chat because it was very tedious going down, but this makes it better. So in general, overwhelmed, I want natural remedies to try first, or how long we should try each of them in order to identify a particular case. I know this is broad, but do you have any general advice on how to start approaching this early on? Yeah, so I mean, my guess, it's not, giving the birth a year ago wasn't the trigger. I mean, there is like postpartum thyroiditis, which again, more closely associated with Hashimoto's. So my guess would be it's not post-pregnancy related. It wouldn't take this long to experience symptoms, but the stress definitely, I mean, that could be a factor as well. So, so diet. And again, you might, you and your wife might want to consider joining the challenge I'm about to have. Because again, you'll get, I mean, just again, not to keep on bringing that up, but it just goes in order. Like it gives gives a lot of information, but also gives a lot of support with the calls. Kind of like this, if you like this format, but with that challenge, I make every effort to answer questions just because there's, anyway. So if you watch, like I said, if you watch the video from the last one, you'll see that's one of the things that I really just try to answer all questions, and there's more guidance there. But I would say diet, again, just diet, lifestyle, for even though it's not the only solution with everybody, it's still a requirement. You still want to eat well, maybe have her follow paleo or ideally autoimmune paleo, and then paleo or autoimmune paleo diet. Stress management sounds like it's a must in her situation. And you'll probably want to do this with her as well. I mean, that's the thing too. If she's going to follow autoimmune paleo, I would encourage you to, since you're on the call here, obviously you care for her, and not, I mean, I'm not saying it's always necessary, but one of the I won't say complaints, but one of the challenges from some patients is the spouse, like cooking different meals. Not that they're complaining about the spouse, but the spouse doesn't, expects to eat this. So again, just I'm just bringing this up just because you're on the call, and if you're going to do like autoimmune paleo, that would make it easier for both of you to do it, and to also stress management. Maybe, I mean, it's definitely not going to hurt for you, assuming you don't have an autoimmune condition or a chronic condition of any type, to do mind-body medicine, meditation, yoga. And then, as far as natural remedies, I mean, I would, some basics so I use testing to try to come up with more specific recommendations. But again, and if you hear, I have a cat to the right of me, so she was sleeping for a while, but she might be coming into the view of the webcam soon. But just giving a warning to everybody. But probiotic for gut and immune health. Make sure a healthy omega-3. So if you're not vegan, vegetarian, like fish oils. If you are, maybe algae oil. And then vitamin D, you need healthy vitamin D levels. Healthy vitamin D is important for a healthy immune system. So those are some things to get started. But there's, again, the adrenals. So I usually recommend testing for adrenals. And one more thing I'll say just about the challenge too. I talk about testing, but I try to talk about as many things, like as many, the goal is not to say take a supplement for everything or do a test for everything. I do talk about supplements and tests in the challenge, but I try to do as much without supplements and without testing. I even have a video, like, finding triggers on a budget and all that. So just for those who might be thinking, well, I'm going to join the challenge and he's just going to say, take like 1 million supplements and do all these tests. That's actually, I will talk about that, but that's not the primary goal of the challenge. So, so someone else asked, and hopefully that helps, Elijah. What test to do to go out to find what thyroid issue? Okay, so I'm not sure what test you're asking. Kind of, I guess, what test do you do to find out what kind of thyroid issue? So, I mean, I would definitely do basic thyroid panel, at least free T3, free T4, TSH, reverse T3. I find more useful in hypothyroidism. With hyper, it's frequently elevated. And then antibodies, so thyroid stimulating immunoglobulins, which are a type of TSH receptor antibody that's specific for Graves' disease. And then, assuming you have hyperthyroidism, but then also I would say get all 3 antibodies. If someone has Graves, I still would recommend getting thyroid peroxidase, TPO antibodies, and then thyroid peroxidase antibodies, and then thyroid globulin antibodies. And I mean, there's other blood testing that I recommend, but as far as you mentioned specific for thyroid. And all right, thanks, David. So David, confirmed Lloyd Burrell has regular emails, glad to hear you on this. Yeah, so Lloyd is great. He had, I mean, the 5G summit was great also. And again, they're having another, I sent an email out, and I'll try to remember send out another one. I try not to go too crazy with the summits, just because now there's like summits like every week, it seems like. And but yeah, I sent one out for that because I'm a bit, yeah, just definitely on board with not being on board about the 5G. So so yeah, definitely sent out an email with that. And Lloyd's EMF summit, yeah, that was really good too. So all right, so how long does it take to normalize the thyroid after getting methimazole? Swollen neck is normal. Sleep much better now. Energy is now low, though. I'm stopping the propranolol this week, one less drug. So it really depends. It depends on the person and the dose of the methimazole. If someone's taking 40 milligrams of methimazole, then they're probably going to become normal sooner. But of course, if they're on 40 milligrams of methimazole, it's because their thyroid hormone levels are really high. Someone's on 15, let's say 15, 20 milligrams of methimazole, and the thyroid hormone levels are high, but maybe not crazy high. But it also, I mean, some people metabolize methimazole. I know some people that they know, even if they're on 5 milligrams of methimazole, they become hypo relatively quickly. Here's my kitty right near me. So just again to let you know, but that's Sandy who's walking on the computer. Okay, Sandy, let's yeah, go over there. Yeah, in the past, I would always have my cats out of the room, but I guess now with the COVID stuff, everybody's so used to people working from home. I'm like, you know what? I'll just let the cat stay, and she looks so peaceful. I feel bad disturbing her from her sleep, but yeah, she actually is a little bit of a pain when she gets up. So, but yeah, so it does depend on the person, but you would hope with methimazole, hopefully within a few months, the thyroid hormone levels would normalize, but sometimes it's a lot quicker, much quicker process. All right, so Brian, I have Graves for 2 years now. I am in remission now. As soon as I found out I had Graves, I went on anti-inflammatory paleo diet. I started taking L-glutamine to help me heal leaky gut. I take many supplements, all natural. The biggest thing that I did that everyone should do is cut out gluten from the diet completely. Yep, I agree. You need to have a healthy gut before you can do anything to help the Graves. I'm taking bugleweed and lemon balm also every day. All right, great, Brian. Yeah, one thing I will say though, not to say you're not in remission, but it would be great. Like when I was dealing with Graves, again, I was diagnosed in 2000, like fall 2008, and was taking bugleweed in fall 2008, but also into 2009. But eventually, I stopped. Like 2009 was the last. I haven't taken bugleweed since. Or I didn't take lemon balm, although some of my patients do. But so I would say the goal should be to be off the methimazole. I'm sorry, off the bugleweed. If someone's taking methimazole, that obviously, but bugle also, you want to be off the bugleweed, off the, if you're on, in your case, bugleweed and lemon balm, mainly the bugleweed. So yeah, I would definitely try if all the numbers are looking good. I know you might be a little bit nervous, so I don't want to, again, I can't specifically say stop the bugleweed, but to me, I wouldn't consider someone to be in full remission until they're off the bugleweed. Now, if someone needs to take low dose bugleweed to maintain numbers, that's great. But if they need to do that, to me, again, that's telling me that something is missing. So, I mean, it's great. Thank you for mentioning cutting out gluten, like, I mentioned earlier. So I agree with that. And, anti-inflammatory diet and L-glutamine. Yeah, I mean, what thing about gut healing, of course, you want to remove the factors like, that might be causing a leaky gut, and gluten is one of those. But hopefully you're able to, also get off the bugleweed as well and the lemon balm. But thank you for sharing that. All right, so this next question is a private question. Actually, there's two private questions. So I sweat profusely, scalp, face, neck, back, chest, abdomen, and clothes get soaked. Other people around me are fine, but doc says TSH, says I need to start back on methimazole, but my heartbeat is regular, eyes not bulging, not shaky. I prefer not to go back on meds. I've gone in and out of remission for years. Yeah, so I mean the eyes, I mean that's the yeah. I mean the question is, are you hyper? So TSH alone doesn't mean you're hyper. So if thyroid hormone levels are elevated, then if TSH is depressed and thyroid hormone levels are elevated, that it could be due to that. And then I would say to, maybe if you don't want to be on the methimazole, then maybe do something like the bugleweed. But also could be hormones too. Could be, I'm not sure as far as as far as age, if you're perimenopause or postmenopause. Not that it can affect cycling women too, um, but yeah, so that might, doing some hormone testing. And again, you need healthy adrenals to have healthy hormones. So even if you do hormone testing, that's another reason I recommend adrenal testing to my patients. Just because most people have adrenal imbalances, and then balances can differ from person to person. So yeah, I would focus so if thyroid hormone levels are high, maybe take bugleweed, and if so T3, T4 high, and then adrenals and sex hormones also. All right, so one other private message here. Diagnosis is primary hyperthyroidism, and the doctor did test for bone density, and it shows osteoporosis increased from 3 years ago. My doctor highly recommends to get the surgery. Do you think this is the best treatment to stop the osteoporosis? I don't have any symptoms at all. I do not take any medication for thyroid. I mean, if you have elevated thyroid hormone levels, even if you don't experience symptoms, that definitely could affect bone density. So, not to say surgery should be the best option. I mean, it's an option to consider, but you could consider taking on a temporary basis bugleweed, maybe to lower thyroid hormone levels, or again the medication methimazole. Although it sounds like again, you might have been doing this. Well, you're not taking currently any medication, but you need to do something to lower thyroid hormone levels, because yeah, even if you're not experience cardiac symptoms, it can affect bone density. So bugleweed, but like I said, bugleweed's not a fix. Bugleweed would be temporary, but you at least take that while trying to address the cause of the problem. Try to detect triggers, underlying imbalances, and yeah. So I again, if surgery, sometimes there's a time and place, but I would try to do other things, and surgery as a last resort. All right, my daughter has taken methimazole for around 10 years. I have heard it's not good to take the drug long term. Are there exceptions? Her liver and other tests remain in range. Thanks for doing this. Sound is very low. Okay, I'm sorry about that. Um, yeah, I don't know if it's just you. Nobody else mentioned the sound, and hopefully it's just you. The mic. I have the mic right next to me, but yeah, if anybody else, if it says low sound, let me know. And then a little bit too late now, but next time I could just make sure. Again, I'm definitely not an expert when it comes to technology, but anyway, yeah, you usually don't see someone on methimazole for 10 years, let alone like 5 years. Um, yeah, so 10 years is a long time, but some doctors, more common in other countries, but sometimes in the United States, a doctor will have a patient on very low dose methimazole, so 5 milligrams or maybe half a tablet a day, which is 2.5 milligrams. And again, it's a better option than, in my opinion, if I had a choice between low dose methimazole or radioactive iodine thyroid surgery, I would take the low dose methimazole. But again, while I would try, and maybe she already has tried, and maybe you've helped her also try to find the triggers, underlying imbalances. But that's what I would recommend while she's doing that yeah, just but yeah, I mean, again, I like I said, I would also, I know someone mentioned for a different problem, the radio frequency ablation. I said I almost definitely would get that before surgery or radioactive iodine. And same thing, methimazole is not a fix, and I'd hate to be on it for a long period of time. But if that was preventing me from getting radioactive iodine or thyroid surgery, and liver enzymes and other tests look good, then I probably would just stay with that. Or again, maybe low dose bugleweed. But even that, as someone else mentioned, that they're on bugleweed, and it seems like it's keeping the thyroid hormone levels in check, but it's still not a fix. All right, so it's 9:31. I'm going to try to make sure I get to everybody at least once. And all right, so here's another question. And again, I'll go another like 15 minutes. So I'm not yeah, after that I'm probably going to call it a night because it's getting close to 10 here. I mean, it's 9:31, so again, I'll go another 15 minutes, but definitely try to go to bed between 10:30 and 11, and arguably should go to bed sooner than that. But yeah, so anyway, I was diagnosed with hyperthyroidism about 10 years ago. However, I've never been on any meds because my blood work. Oh, and also one other thing, I'll do one last check with the YouTube live questions too. Um, all right, so I was diagnosed with hyperthyroidism about 10 years ago. However, I've never been on any meds because my blood work always comes back normal. I've now developed nodules, goiter, which are somewhat noticeable. It does not bother me, but I'm afraid it will grow larger. My previous endocrine doctor told me that I cannot shrink my nodules naturally, which I would love to do. So is there any information you could share with me based on your knowledge? Yeah, I mean, even though the last blog post focused on toxic multinodular goiter, still a lot of the information applied to regular nodules, and I have articles. I mean, I'm going to talk about it in the challenge as well, but I have also information on my website on thyroid nodules, including the most recent blog post and other blog posts on. So typically, with nodules, estrogen metabolism problems are a common cause of nodules, and then insulin resistance, also another common cause of nodules. So estrogen metabolism, insulin resistance, iodine deficiency. It's controversial, and sometimes iodine again could, even with nodules, maybe make things worse. But iodine deficiency could be a cause. Again, this is in the research, but those are the three big factors. So we got yeah, like I said, problems with estrogen dominance, estrogen metabolism, insulin resistance, iodine deficiency. So yeah, you could, but it's not always. It can be a challenge to shrink nodules. So those are the areas I look at, and sometimes we'll do follow-up ultrasounds and see the nodule shrink. Sometimes we'll do follow-up ultrasounds after addressing those imbalances, and they won't shrink. But again, I would before getting anything like surgery or radioactive iodine, because yeah, there is a chance it could grow larger. I mean, I definitely would continue monitoring it every now and then, maybe do a follow-up ultrasound once in a while. All right, you are very welcome, Estella. And then, okay, so sorry, my cat is trying to cause trouble. Um, so this person was diagnosed with hyperthyroidism, have neck and arm pain. Is this normal? Yeah, no, yeah, definitely not normal, and definitely I won't say it's not a common symptom associated with hyperthyroidism. Um, so so yeah, I don't know if that's associated with as far. I mean, the neck pain, it depends on where. I should say the neck pain, like again, if someone has a goiter sometimes, but when you say neck and arm, I'm thinking that's not what you're talking about. So it might be something else. All right. So, Laureen, is there a distinguishing factor between hyperthyroidism and Graves' disease in your referencing? Yeah. I mean, so Graves' disease is typically hyperthyroidism caused by it's an autoimmune form of hyperthyroidism. So the immune system is attacking the TSH receptors, and that's causing the increase in thyroid hormone. But there are other types of hyperthyroidism. I mean, sometimes I'll say hyperthyroidism and Graves' disease, just like using it in like a headline or something, or same thing in the book. I think natural treatment solutions for hyperthyroidism and Graves' disease, because some people associate themselves with having Graves, but and that catches their attention more than the hyper. So it's really mainly to if you're asking why I use those terms, like sometimes in the same sentence, that's the main reason, because some people with Graves, that catches their attention more, and not everybody with hyperthyroidism has Graves disease. So like this is a hyperthyroid chat. just so it's not just for those who have Graves' disease, but other types of hyperthyroidism. I could have said a hyperthyroid and Graves. If I have what my podcast, I'm not sure, if it just focuses on hyperthyroidism, I might say hyperthyroidism and Graves' disease just again. So when people do a search, it'll attract, same thing with the book. So if someone searches on Amazon for Graves, my book should come up, and then same thing with hyperthyroidism. So, but yeah, so not all. So I won't say all cases of Graves is associated with hyperthyroidism, because some are subclinical where they might have elevated antibodies, low TSH, but thyroid hormone levels look okay. But yeah, and then hyperthyroidism, there could be different causes besides Graves' disease. All right, Frank asks, is coffee good for the liver? I mean, it does have some antioxidants. I mean, coffee enemas, you could argue are good for the liver. Which I'm sure you weren't asking, but so I mean, coffee does have some health benefits. Yeah, I wouldn't say specifically for the liver. At least, again, not that I know of. I don't have all the answers, but there are some health benefits to coffee. Okay, and Avril. Good night. Your advice, along with reading numerous literature from you, has helped me to get all the symptoms from my Graves' disease under control, where my thyroid numbers now are normal since 2012. No meds. I still take all my supplements and watch what I eat. My visits to my endocrinologist is once per year. All right, great. Thank you for sharing. All right, so sorry, I keep on moving back and forth now. My cat keeps on going back and forth, but so Graves' disease had to have decompression surgery, lost 95% of vision, taken Tepeza. Yeah, I'm sorry about that. Hopefully the Tepeza helps. So Blake, what tests should be done occasionally and are the most important to monitor my Graves' disease? So obviously thyroid panel, TSH, free T3, free T4, but also the antibodies, whatever antibodies came back positive, probably, I mean, the ones associated with Graves, thyroid stimulating immunoglobulins, although a lot of people have TPO antibodies, thyroid peroxidase antibodies, and then some people have thyroid globulin antibodies, which are more closely associated with Hashimoto's. And then yeah, and then like things like, I mean, every year, I mean, I'm in, so I'm in remission, as you know, but I still would recommend CBC with differential. I mean, I don't know, it depends on the person. Like vitamin D, you want to have healthy vitamin D levels. So, I mean, occasionally what I do every year on myself, I do a full thyroid panel with antibodies. I do CBC with differential. I do comprehensive metabolic panel. I do lipid panel. I do vitamin D. I do CRP, which is a mark of related to inflammation. There's a few others that's not those are the main ones. I think I'm missing like one or two, but those are the ones that I do on a regular basis. But again, it's not I guess it's to make sure everything's in check and just for overall health purposes. Like vitamin D, it's not, or CBC with differential, that's not really for Graves, but just to make sure it's looking good, just so I'm just maintaining a good state of wellness. All right, so all right, I'm going to answer a couple of questions here, and then I'm going to move on to the YouTube and then call it a night. So Stacy, I've been to several doctors over the last 5 years, and that tell me that I have borderline hypothyroidism, and occasionally my thyroid becomes enlarged, and doctors have taken me on and off B12 and prescription vitamin D and will not prescribe anything or refer me to an endocrinologist. I've had significant hair loss for the last 7 years, skin rashes, digestion issues, anxiety, sleep issues, joint issues, and extreme weight gain. I live in Oklahoma. I was wondering what would be the next step. A naturopathic doctor. Yeah, I would. Your situation definitely sounds complex. I definitely would work with a naturopathic doctor, a functional medicine doctor. So yeah, that's, I mean, because yeah, with the hair loss definitely could be due to thyroid, but could also be due to nutrient deficiencies, skin rashes, immune system, digestive. I mean, you have digestive issues, joint issues. I mean, it could be infection related, like Lyme, or I mean, hopefully not Lyme, but could be virus like Epstein Barr. So yeah, definitely, yeah. So I would say it would be it definitely could be a challenge even working with a natural healthcare practitioner, but on your own, it's going to be even more so. Okay, so is there, Maria, is there a link between Graves and high LDL cholesterol? No, most people with Graves actually will have lower lipid panel, like lower LDL, lower cholesterol. So yeah, there's definitely not a link. So it's probably related to something else, the high LDL cholesterol. If someone's taking antithyroid medication and then they become hypo, which is common, then sometimes you'll see those lipid panels elevate. All right, so I'm gonna move on to, okay, well, I'll answer, this is a Hashimoto's question, so, which again, it's a hyperthyroid chat, but I'll answer this quickly. So I've been on thyroid meds for 13 years. Can I reverse Hashimoto's, or has my body forgotten the ability to produce hormones I need? So you could still reverse the autoimmune component of Hashimoto's. And same if someone has Graves, it's different with Graves, but if someone has had Graves for a long time, you still could reverse autoimmune component. Now with Hashimoto's, if significant damage has been done to the thyroid gland, you might still need to take thyroid hormone. The only way to know is to address immune system component and then see what the follow-up thyroid blood tests look like. All right, let's go to YouTube Live. I gotta hold on. I gotta close out of the questions here. All right, so Grace, I'm gaining a lot of weight with methimazole, which so that's might be time to have your doctor reduce that. And then Shelly here says, I just got increased to 30 milligrams of methimazole. Is that a lot? It's a higher, definitely not a low dose. I've seen a number of people on 40 milligrams. Sorry, my cat is like tearing up the place. But I've seen people on 40 milligrams, a few people on 60 milligrams, but over the years, a good number of people on 40 milligrams. So 30 milligrams is 10 milligrams less. So it's definitely not a low dose. And but yeah, I would say it's on the higher side. And Shelly also says glutathione helps with her hoarseness, which is great. And then Cindy says the weakness and no energy are debilitating. Can't get my meds right. So I'm not sure if you're if you're hyper and you took methimazole, which made you more hypo. But yeah, sometimes getting the dosing of the meds can be challenging with both hypo and hyper. And then selenium. Last question. Make this. It's the last question here on YouTube Live. And again, not as many questions on YouTube Live as through Zoom. But does selenium help with Graves' disease? And the answer is it could. Selenium is something I commonly give. A lot of people could benefit from selenium, which is a cofactor for glutathione. Helps with the immune system. So yeah, I would say, and just got to be careful. A common dose is like 200 micrograms, and a lot of people do fine with that, but not everybody. So just be cautious with the selenium. And all right, so I am going to wrap things up and call it a night. But just want to thank everybody for attending. I'll eventually be doing another one of these. Just every now and then, I'd like to, try to be more active. So even if you don't join the overcoming the hyperthyroidism challenge, I'll still do these every now and then. Just if you want more detail and more like regular support for over 21 days, then you might want to consider joining that. But, I'll try like once or twice a month. Might be a little bit crazy while I do the challenge to do these. So it might be, after that. But anyway, like I said, thank you for attending. I'm sorry I can't answer all questions. It's great that there's so many questions. I appreciate everybody asking questions. And again, that's you know, with the challenge, I do make every effort, and I'm bringing that up because someone said I'm registering for the challenge, or I will be registering for the challenge. I do make I make a big effort here too, but just like I said, it's with the challenge, it's easier because there's multiple days, like, you know, 6 days per week. I'm doing things like this to answer questions. But like I said, I'll try to do, you know, this at least once or twice a month. You know, the free ones here for those who are unable to join the challenge. And yeah, and that's pretty much it. Let me go ahead. I'm going to unmute. Usually when I stop these at the end, I just unmute everybody to say our goodbyes. So let me go ahead and stop the share, and we will unmute. If I could find the unmute button here. It's kind of weird. All right, that's weird. A mute button is not, usually there's like a, let me try this. Huh. That's weird. I've done this plenty of times, and I've never had, I don't, again, do it through YouTube usually, but so I don't know if that's, oh, here we go. I'm sorry. It's, all right. Sorry about that. Have a good night, everyone. Thank you for your questions.
Thank you.
Thank you. Take care. Have a good night. Thanks.
Thank you.
Thank you. Bye now.
Bye.
Bye.
No, I'm listening to his